Hi everyone, welcome back to Learn with MedNuggets. In this video, we are going to learn about systemic lupus erythematosus, also known as SLE in short. SLE is an inflammatory multisystem disorder. It is most commonly seen in females than males who are 20 to 40 years old. The etiology of SLE can be hereditary, genetic with an association with HLA1, B8 or DR3, or due to a deficiency of complementary genes in premenopausal women, drugs like sulfasalazine or procainamide, ultraviolet light and Epstein-Barr virus can also be causes of SLE. Moving on to the clinical features of SLE. Generally, a patient with SLE, they will have a fever, which is a paroxysm of unknown origin, just like what you see in tuberculosis and lymphoma, HIV, and renal cell and hepatocellular carcinomas, you see paroxysm of unknown origin. So in SLE also, you will have a paroxysm of unknown origin. And there can be depression, fatigue, and weight loss for general features. Other than that, SLE affects almost every organ. So you will have skin features like rashes, it will affect your lungs, so you'll have pleurisy, it will affect your eyes, and your central nervous system, so you will have cognitive impairment, fits, hemiplegia, features like that, and it will affect your heart, your kidneys, and also it will affect your joint. So there will be symmetrical small joint arthralgias as well, and you will also have blood disorders like leukopenias, thrombocytopenias, and anemias. But the most important features of SLE are arthralgia and the rashes that you see in SLE. For the investigations, the full blood count, there will be low white blood cell counts, predominantly reduction in lymphocytes. Red blood cells will be low because of the anemia. Platelets will be low, that is thrombocytopenia. ESR will be elevated in SLE. The CRP will be normal and only increased in patients with pleuritis, arthritis, or infection. Blood urea and creatinine will be elevated in advanced renal disease. There will be a low serum albumin, so high protein to a creatinine ratio. This indicates early indication of lupus nephritis. And also in SLE, there will be certain autoantibodies that you will see. So the most sensitive autoantibody is ANA. This is the initial first order test that you do. And you will also see antibodies like anti-double-strand DNA, anti-Smith, anti-RO, anti-LA. So if anti-RO and anti-LA are present in a female SLE patient, when she have a child, it can cause complete heart block in the neonate. And also antiphospholipid antibodies will also be seen in 25 to 40% of the patients with SLE. Serum complement level C3, C4 will be reduced in active disease. So you can remember these clinical features and investigations with a simple mnemonic called SOAP BRAIN MD or MD SOAP BRAIN. So M is for malar rash and D is for discoid rash. In SOAP, S is for serositis like pericarditis and pleuritis. O is for oral ulcers. A is for arthritis and P is for the photosensitive rash. For brain, B is for the blood disorders, that is autoimmune hemolytic anemias, autoimmune thrombocytopenia, and leukopenias. R is for renal investigations where you have an elevated serum creatinine or elevated serum blood urea. A is for ANAs positive in patients with SLE, and I is for the immunological test. N is for neurological symptoms. So patients with SLE, they will have neurological symptoms like fits, hemiplegia, cognitive impairment, psychosis, things like that. So this is a mnemonic that you can use to remember the clinical features and some of the investigations in SLE. The management of this patient is, firstly, you have to educate the patient, so to make lifestyle changes and avoid exposure to sunlight and reduce cardiovascular risk factors. So for the medications for patients with SLE, the most important medication is hydroxychloroquine. This is given to all patients with SLE. And other than that, we have to give symptomatic treatment for arthritis, arthralgia, and serositis with non-steroidal anti-inflammatory drugs. We can also give corticosteroids and immunosuppressives to these patients. So we can give cyclophosphamide, azathioprine, immunosuppressives like that as well. So that is it for our video on SLE. Hope you learned something, and if you did, please support us by leaving a comment, liking, and subscribing to our channel. Thank you. Bye-bye.